The person I provide care for has been my two parents.
Fred's dad passed away last year. His mom now is almost 92, and her health has deteriorated, especially over the last 6 years.
They both had reached a point where it was necessary to become more involved with doing what seemed to be simple things in the beginning.
We noticed that they couldn't clean as well, or the yard wasn't taken care of, or because of their physical limitations, doing most any task was very hard on them physically and mentally. So we started offering, how about if we pick you up for the grocery store? Or they would go to doctor appointments and they didn't know what questions to ask. They didn't remember what was said. They needed extra ears to be there.
Taking this long journey of discovery of what's available, how my parents could be qualified for it, and how what my wife and I were doing for them was a very positive effect on their quality of life. That has been very rewarding.
Fred seemed to take the role of seeing what the county offered and the business type of work. I decided I would head to do the research on how I would communicate to his parents. I started researching and would bring that information back to them so they might not feel that they were losing control.
Well, when we moved my folks into the senior apartment complex, which was a subsidy-based building, we also felt that we needed to look into other programs that might be available to them. So we went to our Department of Aging and we first encountered the Caregiver Support Program. And the specialist there explained the program, what it would take for my folks to qualify for that, and what the benefits would be to them once they were qualified. When my dad became a resident of an assisted living facility, she also explained that program, the qualifications, the grant money that would be available, and how that would help my folks. It can become intimidating, the enormity of what you're dealing with, but with the support groups that we found then there are available after you do your research, it becomes a very good feeling.
I think the first advice I'd give a caregiver is what we found is what we ended up calling our little Bible or reference book to keep records.
When you get into an emergency room situation, those questions come up. And in the process of trying to see that they're cared for, it's not easy again to remember all of the illnesses or surgeries they've had over a long period of time. So out of that we developed this binder with the doctor's names, the medications, thumbnail sketch of the medical history. We included in there a durable power of attorney. We added to that a medical directive. I would say the most difficult about being a caregiver is seeing your parents or seeing the person you're providing the care for, having to rely so much on you after they've had such an independent lifestyle of their own. It's difficult for them to comprehend why they're in this situation, and it's difficult for them to understand that you're going to have to be helping them now.
This is a natural progression of family life, that there are certain things that families need from each other, and they're given freely because it's out of being part of a family.